for radiology, and my ID is 2985432. So here we have a dosimetry badge, and it is a film wrapped in an envelope. We should be wearing it at all times when we do x-rays, and should be worn at the thyroid level and always be seen. Records that we have are kept and are able to be retrieved at any time. MPD should be 5,000 MREMs annually. The types of restraints that we use for x-rays would be manually, chemically, and objects to help with x-rays. So manually, it would be an actual person manually holding the patient while doing x-rays. Chemically would be sedation, so medicine to sedate the animal enough to be able to take x-rays if they're really rowdy. And for objects, we could use tape or rope to tie them down to hold them for restraint. We use different positioning aids when doing x-rays. Some of those might be sandbags, which we would use to position the animal in the way we want it to. We also use rope to tie down a leg or whatever if you need to get in a certain position. And troughs for certain positioning for x-rays. For one commonly would be the VD x-ray. For the barium study on a dog, there are risks involved, which would include aspiration. Cause of artifacts showing up on x-rays. Package for barium is 5 to 13 mils per kg of body weight. It's based on a 60%, which is weight divided by weight. For the barium study would be to first give the barium to the patient, then take an x-ray right after, and then wait 15 minutes to do another x-ray, and then 30, and then 60 minutes, and hourly till you get from the stomach to the small intestine. How to put in the measurements of the x-ray machine. We have a 12-pound dog that measured at like 16 by 16. So you're going to look at the grid tray, and it'll be 10 to 15, and say we're looking at abdomen. We go over here, and it's going to be, the kVp would be 88, the milliamps would be 10, the time is 1/30th, and the MA is 200. A physical barrier that could be utilized in a veterinary clinic other than your PPE could be a lead wall if your clinic has one. And exposure time setting on the machine could be utilized by limiting the unnecessary exposure of scatter radiation with making sure the collimation is just the right measurement. Of the human, shielded or unshielded, should be exposed to the primary beam, because even with the covering, only 25% of the beam will be decreased. Essential personnel should be removed from the X-ray suite due to the exposures of scatter radiation, and the risks are not worth it for them or for the clinic's sake. We should make every effort to obtain a diagnostic image on the first try to lessen the exposure of not only the personnel but to the patients as well, and less stress on the patient the better. And restriction for pregnant women and for people under the age of 18 would be genetic damage. And also for pregnant women, the first trimester of pregnancy is when the fetus is more vulnerable to the radiation.